Health-related social needs community capacity building fund webinar. So I will pass it over to my colleague Amber to present just a couple of housekeeping things before we start. So I'm Emily Johnson, Community Health Program Manager at Yamhill Community Care. And then we have a good amount of staff here today to support. So if there's anything that you need, you can use the chat, please, to ask any questions that you have. So you'll see Shanna Moon and Beto Reyes and Jennifer De Leon Cossey, all in the chat available to you to support. You can also reach out directly to me, Emily Johnson. If anybody needs interpretation services, we do have an interpreter here, and we can walk you through getting connected to those services so you can hear Spanish. And then if you would like interpretive services, please put your email address in the chat. You can private message either me or Beto, and we will go ahead and send you the Spanish language slides. So is that anything that anybody needs? And I'll let Liz or Sasha consecutively interpret that for me, just in case.
Hola, ¿qué tal? Muy buenas tardes a todos. En esta ocasión vamos a estar contando con interpretación al español. Si alguien necesita conectarse con alguno de nosotros como intérpretes, por favor, necesitamos que coloquen su correo electrónico en el chat para que les puedan hacer llegar las diapositivas en español.
Okay. I don't see any hands, but let us know. So you are muted by default. So if you would like to ask questions, please put them in the chat during the presentation so we can maintain a really smooth webinar. We will be recording this and posting this on the website. And then at the end, there's a question and answer segment. So feel free to unmute yourself and we can discuss then. We are not discussing individual applications during this webinar. So if you have general questions, please do ask them, even if they do relate to your specific case. If you do need technical assistance, we really encourage people to reach out and seek that directly from us. Again, we can't speak to very individual details of applications, but we can answer questions about what qualifies and what doesn't, what's within the parameters of these types of funding. Just in case, this webinar does not address our general spring RFP. So we already had a webinar for that. It opened on March 3rd, and all of that information, including a frequently asked questions document, is on our website. So I'll put those links in the chat. But if you are here for our other funding stream, all of that information is already available and posted. Okay, so you'll notice that we did start recording, but kind of starting now at the beginning, you are consenting to be recorded by participating in this webinar. Okay, thank you so much, and I will pass it off to Amber.
Thank you so much, Emily. For those of you who have not met me, I'm Amber Kramer. I'm the Health-Related Social Needs Program Specialist here at Yamhill Community Care. I really work as a liaison between our health-related social needs providers and our members and everybody on the YCCO staff to make sure that the benefit is getting delivered as smoothly as possible. So I'm going to walk us through today's content, and then if, like Emily said, if you have any questions at the end, please feel free to ask those. If you have any questions during this meeting, if you want to put those in the chat, that would be great, and we'll capture those and try to get to those all towards the end of the meeting. I'm going to turn my camera off while I'm presenting just so nothing wonky happens. And just a quick overview of our agenda today. We're going to go over all things HRSN, what the community capacity building funds can do, what they can be used for, and then how to apply. All right. So I'm sure by now all of you have heard about HRSN, but just a quick overview of the benefit. The health-related social needs benefit is available to certain OHP members to help them stay healthy during greater times of need. Social needs interventions have been found to improve health outcomes and health inequities, ultimately decreasing healthcare costs. HRSN is an individual member support. It's available as a benefit through Medicaid. It's available for very specific social needs, and it's available to a very specific OHP member population. Currently, right now, there are 3 health-related social needs buckets available through HRSN. So those benefits are climate devices, providing help with things like air conditioners, air filtration devices, space heaters, mini fridges for medication, and portable power supplies for those who depend on medical devices that require power. HRSN also helps with housing, which can help with things like rent and utility assistance for up to 6 months, tenancy supports, which is essentially housing case management, home modifications and remediation, hotel motel stays if those are required during the home modification or remediation process, and storage fees. And then we have nutrition. Currently, the nutrition benefit covers medically tailored meals, which a medically tailored meal assessment or nutrition care plan is required to receive those, and nutrition education. Rolling out later, we are not sure on the exact date, will be the nutrition benefit will cover pantry stocking, meal delivery services, and fruit and veggie prescriptions. The qualifications for the HRSN benefits may seem limiting, but there are a lot of people that you serve that may be eligible. To be eligible for the HRSN services, a person must be a current OHP member under a CCOA or CCOB plan and have at least 1 clinical risk factor and meet the additional criteria for the specific benefit that they are applying for. As stated previously, to qualify for the HRSN benefit, a person must have at least 1 of the HRSN clinical risk factors. These can include things like a complex behavioral health or physical condition, a developmental disability, a need for assistance with activities of daily living, current or past interpersonal violence experience, repeated ED use, repeated crisis encounters, currently pregnant or 12 months postpartum and at risk of certain clinical factors, less than 6 years of age and at risk of certain clinical factors, or more than 65 years of age and at risk of certain clinical factors. This is not as an exhaustive list. To find the whole list, you can visit the OHA Clinical Risk Factor Crosswalk. When these slides are posted to our website, this is a direct link right here that's underlined that will take you to the OHA Clinical Factor Crosswalk that will show you the full list. As part of the HRSN eligibility, a person must also be part of one of the HRSN covered populations. This can vary a little bit depending on what service the member is applying for. The HRSN covered population full list is individuals who are at risk of homelessness. That population criteria must be met for those who are applying for rent and utility assistance. The other covered populations are adults and youth discharged from a behavioral health facility in the past 12 months, adults and youth released from incarceration in the past 12 months, individuals who are currently or have been involved in the ODHS child welfare system. So this can mean somebody who maybe was in foster care in their youth, but now they're in their 50s. As long as that is documented, they have been involved in the ODHS child welfare system at some point in their life, so that would make them part of that covered population. Individuals transitioning to dual Medicaid and Medicare status, or this is brand new as of January 1st, young adults with special healthcare needs ages 19 and 20. Okay, so community capacity building funds are available to support service providers and organizations that will become HRSN providers. The funds are meant to help providers develop what they need to be able to participate in the Medicaid delivery system and deliver HRSN services to qualified OHP members. The purpose of these funds are to support agencies who will be providing the HRSN services, to ensure there are enough HRSN providers to support all OHP members who may qualify for this benefit, and to support agencies in participating in the healthcare delivery system. Community capacity building funds are divided up into 4 available uses. The first use would be technology, which can help with things like procurement of an IT infrastructure, modifying existing systems to support your HRSN work, development of an HRSN eligibility screening tool, onboarding and training to new, modified, or existing systems, in addition to any other technology support that you may need to help provide these services. Development of operational and business practices can support things like developing an HRSN referral and service delivery workflow, training and technical assistance on the HRSN program roles and responsibilities, administrative items that you may need to perform HRSN duties or expand your current service delivery capacity, and planning needs for HRSN program implementation. Workforce development can help with things like recruiting, hiring, and training new HRSN staff, salary and fringe for that staff who will have a direct role in overseeing, designing, implementing, or executing HRSN. I do want to note that this is limited to a time period of 18 months, and CCBF may not be accessed for the same individual more than once. So if you received CCBF in 2024, hired HRSN staff, you cannot apply for CCBF in 2025 to support funding for that same staff person. It can also be used to pay for necessary training, certifications, or education for staff participating in the HRSN program. And then the last bucket is outreach, education, and convening. And this bucket can help with things like producing materials necessary for promoting the HRSN benefit, translation of materials, planning and facilitating community outreach events to support awareness of the benefits, and community engagement activities to support the HRSN program. CCBF is meant to support organizations in becoming HRSN providers. HRSN providers are organizations that will provide the HRSN services in a way that is culturally and linguistically appropriate, responsive, and trauma-informed. Organizations that are eligible to apply for CCBF include, but are definitely not limited to, community-based organizations, patient health navigators, social service agencies, traditional health workers, child welfare providers, government entities, and schools. Organizations that have received CCBF before are eligible to apply, but again, cannot apply for funding for this same or existing staff position. YCCO is administering climate devices in-house, but we are looking currently to add providers to deliver the HRSN housing benefit, the nutrition benefit, and to provide HRSN outreach and engagement services. As an HRSN provider, you are able to invoice Medicaid for your time delivering the HRSN benefit and working directly with members. Outreach and engagement providers can bill for assisting members in applying for the HRSN benefit and connecting members to other resources while working with them to obtain their HRSN benefits. All HRSN providers kind of fall under the same qualifications. All of our providers must be accessible, have the ability and experience to effectively serve a full diversity of members. They must be qualified in the service that they are delivering. They must provide culturally and linguistically appropriate, responsive, and trauma-informed services. They must be able to demonstrate a history of responsible financial administration. They must have the ability or willingness to participate in a closed loop referral process, have the ability to invoice for services, which again, CCBF can help in supporting that activity, getting ready to invoice for services, because we recognize that that might not be something that everybody has done before. You must maintain compliance with reporting requirements and laws regarding privacy and security, and be registered as a provider in MMIS. This can be done after your CCBF award has been granted. Then each of the different HRSN buckets have a little bit of varying qualifications, just dependent on the specific benefit you will be providing. Again, YCCO is administering the climate-specific benefit in-house, but to provide housing services, our providers must have knowledge of housing services covered under HRSN or comparable services, be trained or credentialed to provide that specific service, have the ability to directly meet member needs or connect members to services, have the ability to administer rent and utility payments, and have the ability to coordinate service delivery with landlords and utility companies. Our nutrition providers must comply with laws governing food safety standards, hold appropriate trainings, certifications, or licensure, act in accordance with national nutrition guidelines, must be able to meet members' cultural and personal dietary preference, and have the capacity to provide services on a one-time, daily, weekly, or monthly basis. And then as an outreach and engagement provider, you must have appropriate experience, competency, and capacity in connecting members to resources, have knowledge of cultural responsiveness, have knowledge of community outreach best practices, have knowledge of basic eligibility and enrollment practices of OHP, HRSN, and other federal and state benefits, have knowledge of local community resources for basic needs. In addition to that, have excellent oral and communication skills with the ability to explain complex information and the ability to maintain strict confidentiality and handle sensitive information. OHA requires CCOs to gather information from all of our HRSN service providers to fulfill reports. All HRSN providers are required to report on information including HRSN member identification, HRSN services, their HRSN requests, financial information, HRSN outreach and engagement time, the closed loop referral process, number of referrals accepted versus denied, capacity, and then time from referral to contact and time from referral to service delivery. In addition to the HRSN provider reporting requirements, if you are awarded CCBF, you will also be asked to report on funds spent and activities quarterly. To support the ongoing HRSN work and to expand our HRSN provider network, OHA, as you know, because you're all here, is opening a new round of community capacity building funds. In 2025, YCCO will have a little over $1.8 million total to award. When applying for funding, please remember that there will be multiple organizations awarded. If you are applying to multiple CCOs, please reflect that in your application and in your budget. This month, OHA and CCOs began their outreach and technical assistance for CCBF. The application officially opens April 1st and will close May 30th. June through August, we will be reviewing applications in collaboration with other CCOs and OHA, and in September, we will announce and deliver awards. The CCBF application will go live on our website April 1st. When applying, your application will be scored on things like organization type, counties and regions served, population served, partnerships in current relationships and partnerships in your region served, language access, the ability to provide culturally and linguistically and trauma-informed services. We will be scoring on a clear explanation and planning on how HRSN services will be delivered, and clear explanation and planning of your CCBF use in the 4 allowable categories. We'll also be looking at non-duplicative requests of multiple CCOs. And I want to note that you are able to apply to multiple CCOs for CCBF. But when you're applying, please note that you're applying to multiple CCOs and reflect in your application and budget how the funds you're applying for will specifically be used to serve YCCO members. We are looking forward to supporting you during the CCBF process in multiple ways. The first way that we're making ourselves available will be through technical assistance and support. We're available to answer any questions that you have about CCBF, HRSN, and to provide application TA. You can reach out to the HRSN team directly at the HRSN team email, which is listed here, or to Emily or I individually, and our email addresses are just right below that. So preferred HRSN team, then next me, right after that, Emily, and that is a surefire way to reach one of us. I'm always happy to jump on a call or schedule a meeting to answer any HRSN related questions as they come up. We are also hosting an in-person HRSN Lunch and Learn event on April 2nd at the First Presbyterian Church in McMinnville. This is going to be an opportunity for you to hear from current HRSN providers about what's going well for them, challenges, and their overall HRSN experience. So we would love to have you there. Please come prepared to that with any questions that you may have for those who have been deep doing this work. To RSVP, go ahead and email me for the link. I will also make sure everybody gets the PDF application, which has the clickable link. Finally, this webinar and slide deck will be posted to our website after today's presentation. Please feel free to look back and reference it. We will be compiling a list of frequently asked questions and we'll be posting those to our website. And then I've also included a link to OHA's CCBF webpage. They've compiled their own list of FAQs. They have an application and budget template posted on their website already. So you can take a look at that and get a good idea of what that's going to look like once it's posted. And then again, if you have any questions, please don't hesitate to reach out. All right, that is the end of my official speech. Now, do you guys have any questions? Okay.
One piece that did come up last year that may be helpful is that it looks like there's a lot of money available, and the lift of implementing the HRSN benefit is very significant. And so one thing that happened last year was that we were only able to make partial awards to agencies. So we weren't able to award all agencies that applied. And of those that we could award, they were generally more partial awards. So one consideration that you may want to make within your organization if you choose to apply is, would a partial award still allow full or partial implementation of the benefit in a meaningful way? And when writing a budget, that may be a consideration to make as well. For organizations that are applying to multiple CCOs, we do encourage you to connect with us and talk about building that budget. We've had organizations who really indicate, where different parts of the program or portions of the program are being requested so that we right off the bat can be really clear about any potential duplication or collaboration that needs to happen. That's all I have.
Perfect. Awesome. Well, I will hang out here for a few more minutes. If anybody has any questions, I'm available. I hope that you all consider coming to the HRSN Lunch and Learn just because I like seeing people in real life and it's going to be really fun.
Free lunch.
And it's a free lunch. And Matt's going to be there answering questions. Thank you all.
Thanks all.